I think that we have had a very exciting ECTRIMS meeting. For the first time, it's been a hybrid meeting, and also after 2 years of being only virtual, everybody was so happy to reconnect and to be able to again meet and discuss. So I think I would say that this is the main highlight of the ECTRIMS. I think that people had the possibility to again meet and interchange face to face. And the second one was also the possibility for those who could not attend to also be present with this hybrid format. In terms of science, of course, I will be biased because I'm a clinician, so I will focus mainly on things that I think are more firsthand for clinicians. Okay, so for example, I would highlight that we had for the first phase 3 trial showing that an oral treatment can delay the first attack of the disease in patients that are pre-symptomatic in the radiologically isolated syndrome. So I think this is for the first time we have this information on really delaying the classical onset of the disease, which is a first attack. And I think this is one of the very relevant information that we had this year. Another important I think there is a change in the philosophy of how we understand this disease. Now, we used to classify this disease as relapsing, remitting, and then after 10 to 15 years, there was this secondary progressive phase of the disease. And now there have been several papers, and these also came from the few years before, in which we are understanding that, in fact, the progression starts much earlier, in fact, even before the clinical onset of the disease. And this is this concept of PIRA, which is progression independent of relapse activity. So we are understanding that there is inflammation that is responsible for relapses and UT2, but that there is from the very beginning this progressive disease also from onset. And I think this is very relevant because this changes very much how we put the focus in one of the main problems of this disease, that is addressing the progression of our patients. And I think this is also very, very relevant. Another point that I would like to highlight is also this change in paradigm in which we are understanding that we need to address the inflammatory component from the very beginning in a very, let's say, straightforward way. And this means to use much more high-efficacy treatments from the very beginning, and also registries and data sets in real life are very clearly showing how using high-efficacy treatments from the very beginning is changing also the prognosis and the natural history of this disease. And I think this is another of the important topics that have been addressed. If I have to also highlight something else, I would like to highlight the changes in how we address pregnancy nowadays. For many years, when young women wanted to become pregnant, they were not treated, or their treatment was clearly delayed. or they were undertreated because of the pregnancy desire. And this is also something that is changing. We have now drugs that are approved to be taken until pregnancy is confirmed, or even during pregnancy. And more important, I would say, we have guidelines that show us that even women with a highly active disease, if they can receive high-efficacy treatments, have their disease control, and become pregnant in a safely way. And I think this is also a very, very relevant change in our clinical practice. And finally, I would like to also highlight the importance of many of the, let's say, environmental factors that are so important also, because also these are mainly the factors that empower the patient, because they can control these factors. And this is, for example, very nice data on the role of Mediterranean diet, on the role of giving up smoking, on the role of controlling obesity, on the role of exercise, cognitive rehabilitation, and all this. So all these environmental factors are also key in addressing the disease. And also, of course, I cannot forget the contribution of the Epstein-Barr virus in increasing the risk of developing the disease, which is one of the main, I would say, important highlights also that has occurred during these last 12 months.